Good evening to our listeners and viewers. Welcome to one of SAWAPA's Health and Literacy psychosocial virtual session to support patients living with chronic illnesses. And my name is Dr. Putuka, and today I will be talking about stroke. Let me start sharing the screen now. The 28th of October to the 3rd of November is National Stroke Week, and the 29th of October is internationally recognized as World Stroke Day. Stroke is the leading cause of disability in South Africa. More than 400 South Africans suffer from stroke daily. Some people who survive a stroke will recover fully, but most survivors are left chronically disabled, and 1/3 of these survivors are at risk of having a second stroke within a year. Strokes not only affect the survivor's ability to live a normal life, but it can also have devastating consequences for their loved ones. So having given you a brief background on stroke, what is a stroke? A stroke, or also referred to as brain attack, happens when blood flow to your brain is stopped. It is an emergency situation. Remember, the brain needs a constant supply of oxygen and nutrients in order to work well. If blood supply is stopped, even for a short time, this can cause problems. Brain cells begin to die just after a few minutes without blood or oxygen. When brain cells die, brain function is lost. You may not be able to do things that are controlled by that particular part of the brain. For example, a stroke may affect your ability to move, to speak, to eat, think, and remember, to control your bowel and bladder, to control your emotions, to control other vital body functions. And a stroke can happen to anyone. So what causes a stroke? A stroke is caused when blood flow to your brain is stopped or disrupted. There are two kinds of strokes: ischemic stroke and hemorrhagic stroke. Ischemic stroke is the most common type of stroke. It happens when a major blood vessel in the brain is blocked. It may be blocked by a blood clot, or it may be blocked by a buildup of fatty deposit and cholesterol. This buildup is called plaque. And hemorrhagic strokes occur when blood vessels in your brain burst, spilling blood into nearby tissues. With a hemorrhagic stroke, pressure builds up in the nearby brain tissue, and this causes even more damage and irritation. Having defined what causes a stroke, who is at risk for a stroke? Anyone can have a stroke at any age, but your chance of having stroke increases if you have certain risk factors. Some risk factors for stroke can be changed or managed. We usually refer to them as modifiable, while others cannot. Let's spend some time on risk factors for stroke that can be changed, treated, or medically managed. Cardiovascular problems, atrial fibrillation, which remember we said is a type of irregular heartbeat, plaque buildup in the arteries, and narrowing of the carotid arteries all create changes that lead to a higher risk for stroke. Medications and other medical treatments can help manage these conditions and lower your stroke risk. We also have cardiac structural abnormalities that are also a risk factor for stroke. Damaged heart valves, which is commonly known as valvular heart disease, can cause long-term heart damage. Over time, this can raise your risk for stroke. High blood pressure, this is the number one cause of stroke. High blood pressure is an abnormal force of blood moving through your arteries. The added pressure can weaken blood vessels and increase the risk of stroke up to 1.5 times compared to an optimal blood pressure of 120/80. Blood pressure should be controlled with a low sodium diet and other healthy eating habits, physical activity, as well as medication. Cholesterol is a fatty substance in the blood that can slow or block blood flow through your blood vessels. High cholesterol levels can contribute to thickening or hardening of the arteries, which is known as atherosclerosis, caused by a buildup of plaque. Plaque is deposits of fatty substances, cholesterol, and calcium. Plaque buildup on the inside of the artery walls can decrease the amount of blood flow to the brain. A stroke occurs if the blood supply is cut off to the brain. So working on lowering your working on lowering your bad cholesterol and increasing your good cholesterol by eating healthy, staying physically active, and taking medicine is necessary to control your cholesterol levels. We also have high red cell blood count. A significant increase on the number of red blood cells thickens the blood and makes clots more likely. This raises the risk of stroke. And smoking doubles the risk of stroke as compared to a non-smoker. It contributes to clot formation, it thickens your blood, and also contributes to plaque buildup in your arteries. So do whatever it takes to quit. If it's taking nicotine patches or gum, going for counseling, acupuncture, or any other smoking cessation program. People who have diabetes are up to 4 times likely to have a stroke than people who do not have the disease, largely because of complications of diabetes, such as high blood pressure, atrial fibrillation, and high cholesterol. Managing diabetes by maintaining a healthy weight, exercising, improving eating habits, and taking your prescribed oral medication or insulin are important ways to reduce your risk for stroke. Physical inactivity, this cannot be emphasized more than we do in these sessions. Being inactive contributes to most chronic disease processes and puts you at a greater risk for stroke. Ideally, we should be engaging in regular physical activity 3 to 5 times a week, and also making sure that you do some weight training as well. Extra weight puts greater strain on your entire circulatory system. It contributes to high cholesterol, it contributes to high blood pressure and diabetes, which are all risk factors for stroke. By now, we all know that a healthy diet includes vegetables, fruits, whole grains, beans and nuts, substituting red meat with white meat, and limiting intake of sodium, fats, added sugars, and refined grains. Many studies link alcohol use to stroke. Excessive alcohol can increase blood pressure. Women should ideally have no more than 1 drink per day, and men should have no more than 2 drinks per day. More than 2 drinks per day raises your blood pressure, and binge drinking can lead to stroke. We also have birth control pills on the list. Hemorrhagic strokes are caused by bleeding in the brain. Oral contraceptives increase the risk of stroke by raising blood pressure and by making blood hypercoagulable, which means more likely to clot. And finally, on our list of risk factors that are modifiable, treated, or medically managed, we have intravenous drug use, which carries a high risk of stroke from blood clots, which is known as cerebral embolisms. And the other thing to note is that cocaine and other drugs have been closely linked to strokes, heart attack, and many other cardiovascular problems. Risk factors that cannot be changed include older age. It includes gender. Stroke occurs more often in men, but more women die from stroke. History of a previous stroke. You are at a higher risk for having a second stroke after you have already had one. Heredity or genetics. The chance of stroke is greater in people with a family history of stroke. And other factors also include temperature, season, and climate. Stroke deaths occur more often during extreme temperatures. And then finally, we have social and economic factors. There is some evidence that strokes are more common among low-income people purely because most of them cannot afford a healthy diet, do not engage in physical activity, and also do not have access to treatment as soon as possible. Now let's move on to the symptoms of a stroke. A stroke is an emergency situation. It's important to know the signs of a stroke and get help quickly by calling your local emergency number right away. Treatment is most effective when started right away. Stroke symptoms may happen suddenly. Each person's symptoms may vary, and symptoms may include the following: weakness or numbness of the face, the arm or leg, usually on one side of the body, having trouble speaking or understanding speech, problems with vision, such as dimness or loss of vision in one or both eyes, dizziness or problems with balance or coordination, problems with movement or walking, loss of consciousness or epileptic seizures, severe headaches with no known cause, especially if they happen suddenly. Other less common symptoms of stroke may include a sudden onset of nausea or vomiting that is not caused by a viral illness. They may also include a brief loss or change of consciousness, such as confusion or coma, and they may also include transient ischemic attacks, which are also known as a mini stroke. A TIA can cause many of the same symptoms of a stroke, but TIA symptoms are passing. They can last for a few minutes for up to 24 hours. However, if you have a TIA, call for help right away, because a TIA, a mini stroke, may be a warning that a stroke is about to occur, but not all TIAs are followed by a stroke. So get help fast. Fast is actually an easy way to remember the signs of a stroke. When you see these signs, you will know that you need to call your local emergency line, which is 10177 in South Africa, or 112 if you're using a cell phone. And FAST stands for face drooping. One side of the face is drooping or numb. When a person smiles, the smile is uneven. Arm weakness, one arm is weak or numb. When the person lifts both arms at the same time, one may drift downwards. Speech difficulty. You may see slurred speech or difficulty speaking. The person cannot repeat a simple sentence correctly when asked. And lastly, T, which means it's time to call 10177 or 112. If someone shows any of these symptoms, call right away. Call even if the symptoms go away. Make note of the time the symptoms first started. How is a stroke diagnosed? Your healthcare provider will take a complete health history and do a physical exam. You will need tests for stroke, such as brain imaging and measuring of blood flow in the brain. These tests may include CT scan of the brain. A CT scan can show bleeding in the brain or damage to brain cells caused by a stroke. It is used to find abnormalities and help find the location and type of stroke. MRI. An MRI uses magnetic fields to find small changes in brain tissue that help to find and diagnose stroke. A CTA, this is an image of blood vessels. MRA, this will test for blood flow through the arteries. And Doppler sonography, which is a carotid ultrasound. This test can show if plaque has narrowed or blocked your carotid arteries. The following heart tests may also be used to help diagnose heart problems that might have led to a stroke. ECG, it shows any irregular heart rhythms that may have caused a stroke. And echocardiography, this will check the heart valves, if the heart valves are working properly. And it can also see if there are blood clots inside your heart. How is a stroke treated? Your healthcare provider will create a care plan for you based on your age, your overall health, and past health, the type of stroke you had, how severe your stroke was, where in your brain the stroke happened, what caused your stroke, how well you handle certain medicines, treatments or therapies, and of course, your opinion or preference. There is no cure for stroke once it has occurred, but advanced medical and surgical treatments are available, and this can help reduce your risk for another stroke. Treatment is most effective when started right away. Emergency treatment after stroke may include clot-busting medicines. These dissolve blood clots that can cause an ischemic stroke. Medicines and therapy to reduce or control brain swelling. They are used especially after a hemorrhagic stroke. These are specialized intravenous fluids to help reduce or control brain swelling. We also have neuroprotective medicines. These medicines help protect the brain from damage and lack of oxygen. If the patient, the condition is very severe, we also have life support measures. These treatments include using a machine to help you breathe, which is known as a ventilator, having intravenous fluid to ensure that you get proper nutrition and you control your blood pressure. And last but not least, we have craniotomy. This is a type of brain surgery that is done to remove blood clots. It relieves pressure and also repair bleeding in the brain. Okay, what are the complications of having a stroke? Recovery from stroke and the specific ability affected depends on the size and location of the stroke. A small stroke may cause problems such as weakness in your arm or leg. Larger strokes, however, may cause parts of your body to not be able to move, i.e., you may be paralyzed. Larger strokes can also cause loss of speech and even death. So, having listened to all that I have said, what can we do to prevent a stroke? We need to know our risk factors for stroke. Many risk factors can be changed, treated, or medically modified. Some of the things we can do to control our risk factors include the following: a lifestyle change. What is meant by this? A healthy lifestyle can help reduce your risk for stroke. And this is now: stop smoking if you do smoke, make healthy choices, be sure to get the recommended amounts of fruits, vegetables, whole grains, choose foods that are low in saturated fats, trans fats, cholesterol, sodium, and added sugars. Stay at an ideal healthy weight. Remember, we spoke about being overweight and obese, so we do not want a BMI that is more than 25. Be physically active and limit alcohol use. The following medicines can help prevent a stroke: blood thinning medication known as anticoagulants help prevent blood clots from forming. If you are taking a blood thinner, you may need regular blood tests because we do not want you to bleed uncontrollably if you sustain a cut or any other trauma. Antiplatelets, such as aspirin, are prescribed for many stroke patients. They make blood clots less likely to form. Aspirin is available over the counter. Blood pressure medicines to help lower high blood pressure. Remember, you may need to take more than one blood pressure medication to make sure that your blood pressure is 120/80 and below, ideally. Cholesterol-lowering drugs make plaque less likely to build up in your artery walls, which can reduce the risk for stroke. Heart medicines can treat certain heart problems that increase your risk for stroke. Diabetes medicines adjust blood sugar levels, and this can prevent problems that lead to stroke. We also have several types of surgery that may be done to help treat a stroke or to help prevent one. These include carotid and atherectomy. This is a surgery to remove plaque and clots from the carotid arteries that are located in the neck. These arteries supply the brain with blood from the heart, oxygenated blood, remember, and endarterectomy may help stop a stroke from occurring. We also have carotid stenting. This is a procedure whereby a large metal coil, known as a stent, is placed in the carotid artery, much like a stent is placed in a coronary artery. Surgery to repair aneurysms and arteriovenous malformations. An aneurysm is a weakened, ballooned area on an artery wall. It is at a risk for bursting, rupturing, and bleeding into the brain. And an arteriovenous malformation is a tangle of arteries and veins. It interferes with blood circulation and puts you at risk for bleeding. So before we talk about the take-home message, well, how a stroke affects you depends on where the stroke occurs in your brain. It also depends on how much your brain is damaged. Many people who have a stroke are left with paralysis of one of their arms. Other problems can also include trouble with thinking, speaking, swallowing, doing simple maths tasks such as adding, subtracting, dressing, showering, or even going to the bathroom. Some people may need long-term physical rehabilitation. They may not be able to live on their own in their homes without help. Support services are available to help with physical and emotional needs after a stroke. Strokes can happen again. You need to notify your healthcare provider if you have symptoms that seem like a stroke, even if they do not last long. If you have repeated damage to your brain tissue, you may be at risk for lifelong permanent disability. So now let's get to the take-home message. A stroke happens when blood flow to your brain is stopped. It is an emergency situation. A stroke can be caused by a narrowed blood vessel bleeding or a clot that blocks blood flow. Symptoms can happen suddenly. If someone is showing any sign of a stroke, call your local emergency number. If you need an ambulance, you call 10177, or if you have a cell phone, you call 112 immediately, and you make sure that you tell them the time of onset, because stroke needs to be managed ideally within the first 6 hours. And if we're going to use drugs that are going to dissolve clots, patients should be treated within 3 hours. So it's imperative that you get help, you ask for help as soon as possible. You have a better chance of recovering from stroke if emergency treatment is started right away. How a stroke affects you depends on where the stroke occurs in the brain and on how much your brain is damaged. Thank you. I hope you enjoyed this session. Let me stop sharing now and